Hi everyone, welcome to today's lecture. Today we are going to discuss about the last subtopic in human health and diseases chapter, drugs and alcohol abuse. First we will know what does drug abuse means. Using drugs repeatedly in a way that it harms the health of the human body. Opioids, cannabinoids, and coca alkaloids are the drugs which are commonly abused. Majority of these drugs are obtained from flowering plants and some of them are obtained from fungi. Let us discuss one by one. Opioids are the drugs that bind to the specific receptors which are present in the central nervous system and gastrointestinal system. The specific substance binds to that specific receptor, so only then it can show its function. Heroin, which is also called as smack, is chemically diacetyl morphine, which is white in color, odorless, bitter crystalline compound. This is obtained by the acetylation of morphine, which is extracted from the latex of poppy plant. The scientific name of poppy plant is Papaver somniferum. Generally, it is taken by snorting and injection. Heroin is a depressant and it slows down body functions. The second drug is cannabinoids. Cannabinoids are a group of chemicals which interact with cannabinoids receptors which are present in the brain. From the inflorescence of cannabis sativa plant, natural cannabinoids are obtained. These are generally taken by inhalation and oral ingestion. These show their effects on cardiovascular system of the human body. The third drug is coca alkaloid or cocaine is obtained from coca plant. The scientific name of this plant is Erythroxylum coca. This plant is native to South America. Cocaine interferes with the transport of the dopamine neurotransmitter. Cocaine is commonly called as coke or crack. It shows its action on central nervous system, producing a sense of euphoria and increased energy. The excessive dosage of cocaine causes hallucination. It is the experience of seeing, hearing, feeling, or smelling something that does not exist. Other well-known plants such as Atropa, Belladonna, and Datura have hallucinogenic properties. Drugs like barbiturates, amphetamines are normally used as medicines to help the patient cope with their mental illnesses like depression and insomnia. But these drugs are often abused. Morphine is a very effective sedative and painkiller, and it is very useful for the patient who undergoes surgery. Some parts of the plant have hallucinogenic properties such as fruits and seeds. When the drugs are taken for a purpose other than medicinal use that impairs a person's physical, physiological, and psychological functions. Tobacco are used by human beings for more than 400 years. Tobacco contains a large number of chemical substances including nicotine. Nicotine is an alkaloid. This nicotine stimulates the adrenal gland to release two kinds of hormones such as adrenaline and noradrenaline into blood. Both of these raise blood pressure and increase heart rate. Smoking is associated with lung cancer, urinary bladder cancer, and throat cancer, bronchitis, emphysema, coronary heart disease, and gastric ulcer. Smoking increases carbon monoxide content in the blood and reduces the concentration of heme-bound oxygen. This causes the oxygen deficiency in the human body. Next, moving on to adolescence and drug or alcohol abuse. Adolescence means it is a period during which a child becomes mature. The period between 12 to 18 years of age may be considered as adolescence period. In other words, adolescence is a bridge that links childhood and adulthood. Adolescence is accompanied by several biological and behavioral changes. Thus, it is very vulnerable phase of mental and psychological development of an individual. Next, coming to addiction and dependence. Addiction is a psychological attachment to certain effects such as euphoria and a temporary feeling of well-being, which is associated with drugs and alcohol. These drive people to take them even when these are not needed, or even when their use becomes self-destructive. With repeated use of drugs, the tolerance level of the receptors which is present in the human body increases. The receptors respond only to the higher doses of drugs or alcohol, leading to greater intake and addiction. Thus, the addictive potential of drugs and alcohol pull, pull the user into a vicious circle, leading to their regular use from which the person may not be able to get out of this. Then what does dependence mean? Dependence is the tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if regular dose of drugs or alcohol is abruptly discontinued. Withdrawal syndrome means it is a set of symptoms that occur when a person stops or reduces their use of a substance to which they are dependent. This is characterized by anxiety, shakiness, nausea, and sweating, which may be relieved when use is resumed again. In some cases, withdrawal syndrome can be severe and even life threatening, and the person may need medicinal supervision. Next, moving to effects of drug or alcohol abuse. The immediate adverse effects of drugs and alcohol abuse are manifested in the form of reckless behavior, vandalism, and violence. Reckless behavior means doing something dangerous and not worrying about the risk. Vandalism is the action which involves deliberate destruction of public property. Excessive dosage of drugs may lead to coma and death due to respiratory failure, heart failure, or cerebral hemorrhage. Alcohol abuse among youth include drop in academic performance, unexplained absence from school or college, lack of interest in personal hygiene, isolation, depression, fatigue, aggressive and rebellious behavior, deteriorating relationship with friends and families, loss of interest in hobbies, changing sleeping, eating habits, fluctuation in weight and appetite. Those who take drugs intravenously, that is through direct injection into vein using a needle and syringe, are much more likely to acquire serious infections like AIDS and hepatitis B. These viruses are responsible for the diseases which is transferred from one person to the another by sharing infected needles and syringes. These diseases are chronic infections and ultimately fatal. The chronic use of drugs and alcohol damages nervous system and liver. The use of drugs and alcohol during pregnancy is also known to adversely affect the fetus. These are the effects of drug and alcohol abuse. Next, moving to prevention and control. Some of the measures can be taken for the prevention and control of alcohol and drug abuse among adolescents. The first one, avoid undue peer pressure. This means every child has his or her own choice and personality which should be respected and nurtured. A child should not be pushed unduly to perform beyond threshold limits, be it studies, sports, or other activities. The second measure is education and counseling. Educating and counseling the child to face problems and stresses and to accept disappointments and failures as a part of life. It would be worthwhile to channelize the child's energy into healthy pursuits like sports, reading, music, yoga, and other extracurricular activities. The third measure is seeking help from parents and peers. Taking help from parents and peers should be sought immediately so that they can guide appropriately. This would help young to vent their feelings of anxiety and guilty. And the fourth measure is looking for danger signs. Parents and teachers need to look for and identify the danger sign. The last measure is seeking professional and medical help. A lot of help is available in the form of highly qualified psychologists, psychiatrists, and de-addiction and rehabilitation programs to help affected individuals. If these preventions are taken, the child can live a healthy life. This is all about drugs and alcohol abuse. This completes the chapter Human Health and Diseases. Thank you.